name is Stavi Xinos. I work as a data analyst and an MSW, or Master of Social Work intern, for the Open Door. So the Open Door is a harm reduction housing first agency. I'm very passionate about harm reduction, and we work with populations who are affected by chronic homelessness and HIV. That often overlaps with substance use, criminal injustice system involvement, and queer and trans group membership. So I get to work with really diverse participants. When I was an undergrad and I was getting placed for my first field placement for my Bachelor of Social Work degree, one of the issues I was interested in was like gender and sexuality, and I guess they kind of took that as like women's issues, and they ended up placing me at a women's shelter for survivors of domestic violence. I started working there as a counselor for my first social work internship. I then was hired as a resident counseling advocate in their shelter. So I was like really in the thick of it in the shelter and on the hotline in that job. Part of my work at the Open Door is training the staff on how to intervene in domestic violence so we can build like community capacity for it. But I've customized all of my work to include and uplift and focus on like diverse survivors. When you possess any kind of non-normative or marginalized identity, you experience domestic violence very differently. There are a lot of unique barriers to achieving safety and well-being in that capacity, so I try to kind of bring that intersectional aspect into my domestic violence work. I did a lot of research on how people who use substances are affected by domestic violence, how domestic violence intersects with homelessness and chronic homelessness. I looked into considerations for queer and trans survivors of domestic violence, and then I looked at people affected by domestic violence with HIV. I really want to change the world, even in some small capacity. I'm really interested in research and policy analysis to kind of make the changes that I'm talking about. We know our policies exclude, anyone who's affected by oppression. People who use substances, Black and brown communities, are all subject to over-policing and incarceration in result of that. And so who do our policies really help? I'm interested in feminist, community-based, social justice-oriented research that can help inform and reform our policies.